Yes.
How you doing?
Really good.
When you talk about butter, what's that relationship to sodium? Most butter has significant amounts of sodium, and if you're in a congestive heart failure system, they really want you to watch your sodium.
Yes, and that
Say a low sodium diet and butter.
Yep.
That's the answer, isn't it? Or
Sodium is a very interesting topic, and actually still is in kind of a controversy. For a long time, sodium was just bad news. Everybody should be on a low salt diet. Well, that's not really true. Some people don't do very well on a low salt diet. But when you have a specific entity like congestive heart failure, where you have a very fine balance between too much and too little water in your system, you got to regulate that. But again, I ask you to step one back and follow this diet. Otherwise, I'm not talking about butter, but follow this stuff to make your microbiome better, because then you have a reduced inflammation. And it's inflammation that keeps whittling away at your heart and making your congestive heart failure worse. So thank you for letting me say one more time that whole thing. But, so sodium really only is an issue for those with specific problems. Even people with hypertension, which you say, oh, everybody with hypertension, stay away from it. There's actually a very small amount of people that have hypertension that actually have any change with or without salt. So sodium is not that actor. If you don't have a diagnosis, sodium is not your problem. Don't layer it on, just enough to taste, but it is not the villain. But yes, when you have specific entities, there are other things other than congestive heart failure. But in that case, you do kind of have to watch that. So you have to get the low sodium butters, low sodium foods. Yes?
You talked about turmeric,
Yes.
kombucha.
Kombucha, yeah.
Yeah, do you do that? Do you drink kombucha every day?
Every day, yeah. Yeah.
I mean, and does it hurt you to drink more than one thing of?
I think, good question. Actually, what you should do is probably have maybe 2 or 3 ounces before each meal, because now you're prepping your intestines with that. I average about 8 ounces of that every day, and I make it myself. I use honey as my sugar source. Honey is not glucose. Glucose in fruits, citric fruits. It's a mixture of glucose. Okay, the molecule, like sucrose, like table sugar, is a mixture of 1 molecule glucose, 1 molecule fructose. Fructose is a chief offender of calling fatty liver. We never used to have fatty liver back when I first started practicing medicine, but with the advent of high fructose corn syrup, it's all over. You heard about fatty liver or NASH, non-alcoholic steatohepatitis. Fructose is doing a number on us. Fructose increases your risk double for getting diabetes. And that's why when people say, well, you got to eat a lot of fruits, right? I say, you know what? Berries. Citric fruits are not so good. Apples, the only way you really should eat apples is if you chop it up, you put it in some water, you boil it for about 7 minutes, you throw some cinnamon in it, and then you put it in your fridge for 24 hours. Now you've created resistant starch that feeds the good bacteria. And you can add whole fat whipping cream on top of that. That's good. Nothing wrong with it. That's good for you. That's the sweet. That's the only sweet I think I've had in weeks, if not months, or even years. I don't eat any sweet. And the good news is that, like I talked about, the addiction towards carbohydrates, if you get off of it, you lose the taste for it. It's cultured. You culture it. My mom cultured it with chocolate. It took me a long time to get rid of that. But interesting, I'm not sure if I should probably mention this. You might have to cut this out of the recording. But when I started this venture of different diet 3 years ago, I would have a beer, at least 1 beer every day. I brewed my own beer because I didn't want all the chemicals and all that stuff. I'd have 1 or 2 beers a day. But when I got on this diet and stopped all the carbohydrates, I lost my taste for beer. And I'm not that happy with that part of it. So I drink red wine, drink a glass of red wine every night before bed. Wine, well over 77 studies have shown that alcohol in the right dose is good for you. In fact, in Canada, and I don't know if they do that now, but it used to be when they would do an assessment of what your cardiovascular risk is, they'd ask you, okay, what's your weight, and, family history, all this stuff, and then you get checks for all this stuff. If you said, I do not drink, they chalk that up as a risk factor for cardiovascular disease if you did not drink. Now, if you drink too much, of course, that's good, but if you have the recommended amount, which is 4 ounces of wine, 1 beer for a female, double that for a male, or complementary 1 shot for a female alcohol, 2 shots for a male. Yeah, that's good every day. It improves your HDL, it reduces your blood pressure. It's a good social lubricant, so there is benefit to doing those things. So alcohol is on the diet.
What about vinegar?
Vinegar is fine. Acetic acid, yeah, it's fine. It's a good thing. Vinegar is very good when you are trying to, make your sauerkraut or different products. Vinegars. A lot of people do that, and it's in the naturopathic treatment for GERD or gastroesophageal reflux. They have you drink vinegar, and it sounds odd because you're taking an acid because of an acid issue, but there's a counterbalance going on. I haven't ascribed to drinking vinegar every day. I think that would put me over the edge with my wife. She'd have to run me up on charges on that one. But, yeah.
What size dosage of fish oil or omega-3 should a person take each day?
Very good. And again, the question was how much omega-3, and omega-3 most of the time comes with 2 different omega-3s. Every capsule you get the EPA and the DHA, and you want to get that with both. EPA is good for your stomach, DHA is great for your brain. 3,000, let's say, recommend. I take 2,000. I really should, do what I say. I probably shouldn't have said what I said, but you should take 3,000. 3,000 is the dose that achieves the maximum benefit of that. And by the way,
You take that when you buy the fish oil tablet?
yeah. And you don't have to take it all at one time. You can spread it out in different meals. And by the way, that is on the list. And when we're all done here, we're going to hand out some pieces. We're going to hand out 2 pieces of paper. One is the supplements that I recommend, and the other one is foods that help ward off Alzheimer's. And so my second and third talk, I do talk about Alzheimer's and how you get into that, but the Cliff Note version of Alzheimer's is that sugar, glucose, irritates your cerebral arteries, and your artery response is to make amyloid, and amyloid is what they find when they do autopsies. Some have called Alzheimer's diabetes type 3. So, again, it would improve with this kind of diet. By the way, there is no medication that helps Alzheimer's. Aricept gives marginal improvement for only 6 months. So if you've got a loved one on that more than 6 months, get off it, because Aricept also reduces your cognitive abilities 10%. So you've got someone with cognitive disability, and you're giving them something to reduce cognitive abilities. It just doesn't make sense to me. And then they'll put you on Namenda. Namenda has never been shown to work. Fish oil has been shown to work, but they won't suggest that. Get everybody on fish oil. Everybody should be taking fish oil.
Are you going to do a presentation on Alzheimer's?
If I'm asked to come back. Yeah, that's part of the second and third talks that I do. So, yeah, there's a lot on Alzheimer's, and there is some hope on Alzheimer's as well. And there's some very dire statistics that we don't do anything, it's going to really get us. 1 out of 16 people by the year 2050 will have Alzheimer's past the age of 65. That is the #1 costly disease that we have. Not from the medical care, but from the comfort care and the nursing home cares. Alzheimer's is huge. We got to do whatever we can. And that is one of the reasons why I'm here. My mother-in-law has it. We got to do something different, folks. We're getting sick. Our society is getting sicker and sicker. We're getting dumber and dumber IQ-wise. And it's because of this fog that is created by all these things that I've talked about. Our kids don't even compete on an international stage with science and math anymore. They don't even go because they're so embarrassed. They don't even rank with Japan and Germany. These other places. Germany has outlawed GMOs, has outlawed Roundup, and it's for a very good reason. GMOs are not good for you. Virtually all the soy that you consume and 80% of the corn that you consume are GMO products made by Monsanto. Made by Monsanto so they can spray a Roundup on it so that you can go ahead and get your liver disease, cancer withdrawal. So yes. John?
I was wondering about the exposure to aluminum in America and how that relates to places where the microbiome, is healthy.
That is a very good question. The question is, what is really the role of aluminum, or how does aluminum affect our microbiome? And I think the reason why you're asking, you probably know the answer, but the question is because aluminum is found in high concentrations of people with Alzheimer's. And has gone round and round to say, is it just a passive occurrence or is it a causative agent in that? And they have not come up with the answer on that. But certainly aluminum, we need trace metals to act as cofactors for our enzymes to process our proteins, to make our cells, to make our hormones, to make everything we are. So we do need trace amounts of copper, trace amounts of aluminum, trace amounts of cobalt, all those things. But we don't need a lot of it. So that's a very good answer. And I do not know if aluminum taints the microbiome. I don't know that answer, but I'll look that up. That's a good question.
You spoke about autism,
Yes.
and you said that it was because of diet.
Autism is probably multi-factor. It's not quite as simple as I may have portrayed it. But when you do have autism, or possibly in the generation, or the evolving diagnosis of autism in a child, or the potential for it, if you have a bad microbiome, you have a much greater chance of developing autism than if you were to have a good microbiome from birth with a mother that has had a good microbiome prior to birth. That has a much less chance of getting autism. Of course, there's a big thing about vaccines causing autism. I think Jane McCarthy brought that up 15 years ago or something. It's kind of poo-pooed its way. However, there are problems with vaccines. But I'm going to tell you right now, get yourself vaccinated. Do not do vaccines. There are some things with it, but when you look at a population, so we vaccinate based on populations, trying to keep everybody healthy. There will be a few that fall out of that. But if we don't do vaccines, we're going to get a lot of people sick. We're going to get a lot of people sick. The measles outbreak is not because people in America aren't because of a failure for your measles vaccine per se. It's from people from outside of America that come in and didn't get the measles vaccine and then had it in a florid way that spread that to those that were only marginally immunized. That's the measles outbreak. You know, the only way we don't have smallpox these days is because of immunization.
Well, so, I mean, because I've seen families where there's been only one child in, say, 3 that has autism. So what?
So why just 1 instead of 3 if it was genetics? Is that kind of what you're asking?
So if only one has autism, what would you say would explain that?
I wish I knew the entire answer to that. But it has something to do with something that happened probably in utero or shortly thereafter. And I'm certain that it has something to do with inflammation. And so, was it diet? Was it exposure to something else? Was it a chemical that they were exposed to? I mean, it could be multivariate. But all I know is I used autism as an example to say that you can change the expression of autism by having a healthy microbiome.
Okay.
So,
Okay.
yes?
I got a couple questions.
Sure.
First of all, is palm oil good?
That's a good question. Some forms of palm oil are good. And there are certain brands that are good. The problem with palm oil isn't so much that palm oil is an issue, is it how they get palm oil. And palm oil is one of those things that they're, I hate to get too far into a political thing or a climactic thing, but they're just stripping all sorts of forests and getting rid of very normal habitat for indigenous species and then putting up palm trees to make palm oil. So I don't recommend palm oil, even though there are some palm oils that are good for you, red palm in specific. But if you're gonna look for oils, I would much rather have you go to coconut oil or at lower heats go to olive oil. Avocado oil is good, walnut oil.
And then you said, like, to make potatoes and apples.
Sure.
If you're using coconut and then you put them in the refrigerator for a day or whatever.
Yep.
What's going on in that process that's making it okay to eat then?
What happens is a starch, what a starch is it's a bunch of glucose molecules pinned together in a long straight line. The problem with that is that when you take that kind of starch and you ingest it, your enzymes do a great job of chopping all that up so you get a lot of sugar. That's why boiled potato gives you a lot of sugar really quick, because it's so easy to take apart that whole strand. It's like you just take the filament out of a bead of pearls, they're all there ready to absorb. If you take that same product, and that includes potatoes, rice, apples, you take that or your, what would classify it as a starch, you like your squash and different things like that. If you cook them, which does certain things to the proteins and to the chemicals, and then you cool them down, what happens is that long line of a straight line carbohydrate turns on itself through the cooking process and then the cooling process and makes bonds in different directions. So it's globular, so that when you eat it, it's not easy to digest. It actually passes through where you would normally absorb that rice or that potato. It goes further down into the bacteria that actually can absorb that and use that. So your good bacteria love that and they grow better with it. Yeah.
Does that mean Lefse is really healthy?
More Lefse. More Lefse. Yeah, I guess so, because it's cool, right? Hey, Lefse's on the radio. That's on that table. Roll your onions up with Lefse.
With butter.
With a lot of butter. Yeah.
And eggs.
No sugar on it.
Maybe honey.
Yeah, okay, that's a good question. So what sugars, if you do have you want to taste something, you want to sweeten something up, what sugars should you use? There is something, it's called an alcohol sugar, it's called erythritol. That's probably the only one that I recommend as far as that is concerned. Also, stevia. Stevia is actually a natural plant that is 200 times more sweet than actually sugar is. But the type to get is the leaves that's been ground up, so you actually are sprinkling dried, pulverized leaf on it. That has two different chemicals. One actually has been shown to improve heart disease, but not Splenda. None of the other artificial sweeteners. It's not good for you. There's never been a study that shows that anybody that does diet anything is less heavy. It doesn't work. In fact, someone who drinks diet pop versus sugar pop has double the rate of diabetes from the diet stuff. Get whole fat food. No low fat food. If something says healthy, it probably isn't. If you read a label and you can't pronounce it, don't buy it. When you go to the grocery store, stay on the periphery. That's whole foods. That's your veggies, fruits, and all that stuff. If you venture inside, you venture into illness. If it comes in a bag or a box, it's not good for you because it's got preservative, it's got all this other stuff, and it's probably sprayed with Roundup for its finishing before they process it.
Are you saying whole milk is better than skim milk?
If you could, yes, whole milk is better than skim milk from a good cow. The cow is not the enemy. It's what you feed the cow, right? And my mother, she's my sister. We were raised on skim milk, and that's all I had to taste for. And it's been really tough. I'm up to 2% now, and I vow to get to whole milk. I know, late is over. So yes, whole milk is the way.